good morning, everyone. Welcome back to hour 2 of our annual Health Week. And here we are at OMNI Orthopaedics, and we're going to talk a little bit more about sports medicine, specialized training, and a lot of other things with Dr. Melissa Bickett. Good morning, Dr. Bickett. How are you?
Good.
Where do we drag you out of?
Clinic, in the middle of seeing patients.
Very good, very good. So tell me about your specialty here at OMNI.
So I'm an orthopedic surgeon, but I specialize and have my certificate of added qualification in sports medicine. Sports medicine focuses primarily on arthroscopy, so like rotator cuffs, ACLs, but I also do hip scopes. But I'm a little bit of a generalist also, meaning I still do a little hand, a little foot. I still take trauma call to fix fractures and stuff like that. So I do a little bit of everything, but majority of my training has been focusing on sports medicine and the athletic person.
All right, so what's the most you're seeing these days? What are you seeing the most of? Kind of injuries, what types of injuries?
Well, I do love the older patients that have a midlife crisis and go to CrossFit. And those come in with like rotator cuff injuries, labral tears, stuff like that. But a lot of what I'm seeing is just people who are trying to enjoy their lives, whether it's someone who's playing football, a teenager, football's going to be ramping up here in a little bit, but just people, sports makes you happy. And I see the people that unfortunately, nothing's 100% guaranteed, they injure themselves. And it's a little bit of everything. I wouldn't say I see a majority of anything, but just a person trying to make themselves better, healthier, happier. And unfortunately, injuries happen, so I'm seeing those.
Golfers? You see golfers?
I do see golfers, but I'll be honest, not a ton of injuries golfing.
That's good.
Yes.
See? You made a lot of guys happy
There is
now.
Golfer's elbow. Don't get me
I've
wrong.
Heard that.
Yeah.
I've heard that.
It's the opposite of tennis elbow.
And so what is it? What is golfer's elbow?
So tennis elbow is on the outside of the elbow. Golfer's elbow is literally the inside of the elbow.
Okay.
It's just the opposite side. But it's the same thing, just the other side, literally.
Okay. All right. So how do you prevent these things from happening?
So with any sports injury, the problem is a lot of people just go out and they only do golf, or they go out and just go run. The way that you help prevent injuries is trying to stretch, stay strong. You can't just go out and do your one activity. And I actually talked with Dr. Daly, and he told me about how he was getting into the specialization of kids just doing one sport. Well, but even for adults as you get older, you don't want to just golf. You want to still strength train. You still want to walk. You still want to elliptical. You still want to stretch. And I mean, you ask people and you're like, when's the last time you stretched? And they're like 20 years ago.
Yeah. That stretching to me is one of the best things ever. I don't know, because I couldn't survive if I didn't. Because it makes you feel better, in my opinion. I mean, even if you don't exercise afterwards, just stretching in general, right?
Yes. And that's why even yoga or, Pilates or whatever people want to do, all of that stuff is still sports in my mind. Sports is not just going out and golfing and basketball and football and soccer. It's any athletic activity that you want to do. And yoga, especially the people who get into hot yoga, makes me laugh. But when the people get into hot yoga, that's still athletic activity that they're doing. They're just sweating to death while they're doing it.
Right. Are women more susceptible to any types of injuries, than men? Or
actually,
different?
ACL tears. And there's been a lot of research of why there's a higher percentage of women that tear their ACL compared to men. It started off with because of were they on their period? Were they, cycling? There's a lot of different things. What that all came down to is no, there's no hormonal based difference. What we really think the difference of women tearing their ACLs is more of the way that our bodies are built. We tend to be a little bit more knock-kneed, a little bit more turned in, and then we don't do the strength training that a lot of guys do. And that's the unfortunate part of a lot of these young women getting into sports are not weightlifting to go with it. And so if you look at it, if you think about a male soccer player and a female soccer player, and soccer is one of our highest ACL injury sports, male soccer players still go in the weight room all the time. I played soccer. I don't remember us going in the weight room barely at all.
Yeah.
Because we would have to go run and go play soccer and do the drills, but by no means do you see a lot of young ladies out there squatting,
Right.
bench pressing. But so we don't have the same strength to go with the same sport that we're playing.
What do you suggest for people to try to, keep themselves healthy or injury free?
So I think one of the lost things as we get older is that we're not strength training as much. And that's one of the big things of like men versus women. I think if we can really push for people to still lift weights, to still strength train, and to get women more interested in doing something like that, I think that's a great way to help prevent injuries, because the stronger you are, the more agile, the better your joints move, you're less likely to injure yourself if your muscles can support your joints with it.
Okay. Are there any like at-home remedies for people maybe who feel like they have a little bit of an injury, but maybe not something they necessarily need to come have treated, or they're not sure?
Oh, yeah, absolutely. I tell people all the time. In fact, a lot of times when people come to see me right away, I'm like, well, ibuprofen, Aleve, rest, ice, compression elevation. I tell people all the time, unless you feel like a pop or a tear, if it's just more like you sprained something, you pulled something, you try that stuff first for a couple weeks before you come to see someone like me. I kind of joke, we're a surgeon, we got knives in our hands when you come to see us in the clinic. Just kidding, of course. But it's one of those things where save yourself a visit, try some of the basic stuff first. Now, if you feel a pop or a tear, that signals to us that something tore, which, yes, maybe you want to come see us sooner. But if you were just kind of jogging and you felt your thigh pull, or if you're golfing and your elbow just starts to ache a little bit, I mean, we're in the world now where you can literally Google anything and you look up elbow hurts while golfing. And so golfer's elbow comes up. And then you can look up some of the stretching or some of the therapy exercises. You take some ibuprofen or Aleve, you kind of ice, rest it a little bit, and give it some time. And if you don't get better, then you come and see us. And then that's when we can talk about official therapy, or maybe injections, or other stuff that we can do, or maybe prescription strength anti-inflammatories, taking the medicine. But by no means do I think we should be the first person out of the box for your more basic injuries. But I always tell people I'm more than happy to see you. A lot of people don't like looking at WebMD. They're afraid that they're looking at the wrong thing.
Right.
And I know Dr. Daly said it earlier too. We're always happy to talk to you, counsel you, educate you. I was totally joking about the knives, but we're always happy to come and see people, to come see us here at OMNI and talk to you about your injury, what it means, and if nothing else, just to educate you to what to do and how to prevent it in the future.
All right. Well, that's a lot of great advice. Dr. Bickett, we appreciate you coming by today. Thank you so much. I'm not going to keep you from your patients anymore.
I ran here in my boots.
You did great. Great job. Thank you so much.
Thank you.
All right, we're going to take a quick break, and when we come back, we're going to talk to Tim Lynn, who is with OMNI Orthopaedics Physical and Occupational Therapy, and what that means for folks, and how it can really, really help you maybe avoid some surgery. We'll do that as Health Week continues here on 1480 WHBC.